Hi, my name is Jasmine Jones, and today I will be discussing the descriptive epidemiology of COVID-19. Okay, so a slight overview of what is COVID. COVID-19 is a disease caused by a virus called SARS-CoV-2. It spreads from person to person, mainly through tiny droplets when people cough, sneeze, or talk. It was declared a global pandemic by World Health Organization on March the 11th, 2020. Some of the symptoms that people may have experienced if they were to have caught COVID were fever, cough, trouble breathing, tiredness, loss of taste or smell. Who was affected? So, most people, especially around older adults, were affected by COVID, especially those 65s and up, were hit the hardest in terms of severe illness and death. But that didn't mean that younger people didn't get sick. They could also still get infected, although their symptoms were usually milder. Between female or male, males had a 2.37 times higher mortality rate than females. When it comes to race, minority groups, especially Black and Hispanic populations, were disproportionately affected. This wasn't random. It was tied to longstanding healthcare disparities that put these communities at higher risk. Also, within those low income communities, a lot of Black or Hispanics people didn't typically have health insurance or a way to even get to a healthcare facility to where they can be treated. So in terms that put them in more danger than everyone else. Socioeconomic class played a huge role as well. Lower income individuals had a higher chance of exposure, often because they work critical jobs where they couldn't just stay home. For example, you had healthcare workers, grocery store employees, and public transportation workers that were all on the front line and faced a much higher risk of getting infection. But at the same time, even though COVID had happened, the world couldn't just stop. Everything still had to be moving because we all have our everyday lives. Even marital status had some influence. While it's not entirely sure if being single changed infection rates, people who did live alone struggle more with mental health issues during lockdowns, especially a lot for kids or students. They had to typically stay in the house more, lose connection with their friends face to face, and tend to be more on their phone, which is when AI and technology made its mark and decided to explode from there. Because so many people were already accustomed to using that during COVID, it just felt normal. So, where did it spread? The spread of COVID-19 wasn't uniform, it varied by location. In big cities like New York, the virus spread quickly because of high population density, whereas rural areas, on the other hand, saw fewer cases at first, even though they were hit later on. So global spread, there was an initial outbreak in China, Wuhan, Hubei province. There was a rapid transmission across Europe, the United States, India, and Latin America. On a country level, the US and Brazil had major outbreaks, while places like New Zealand managed to keep things under control with early interventions. Even within the United States, different regions experienced waves at different times. So, for example, the Midwest saw surges later than the coastal states. And within the US, higher burden in urban areas, low income neighborhoods, and areas with healthcare disparities saw COVID rates at a much higher rate. At a more local level, neighborhoods with lower income populations and high population density were often hit the hardest, mainly because people in those areas had less access to healthcare and lived in more crowded conditions. Whereas in India, and I attached a graph on the side where you can see the numbers of the COVID cases and the rate, how fast they were coming. There was a high mortality in elderly males with chromatography comorbidities and the significant differences in mortality rates across states and hospitals. Now, To get into the physical and biological part of it, the physical environment was typically poor air quality and limited healthcare access, which made COVID-19 outcomes worse in certain areas. Plus, crowded living situations made it easier for the virus to spread. So, in terms with the air pollution, there was higher levels of air pollutions that was associated with worse health outcomes in COVID-19 patients, meaning that individuals lived in polluted areas might experience more severe symptoms or complications from the virus. Whereas with the healthcare access, there was limited healthcare access to healthcare services, which led to poor health outcomes for people who were experiencing the COVID-19 infection because individuals couldn't probably have experienced the health they need, the time to be treated at the timely matter to get medical attention or treatment. And with the crowded living conditions, living in crowded settings facilitates the transmission of the virus at a much quicker rate, which made outbreaks more likely to occur and spread rapidly within communities because people wasn't being distant from each other. They was being up close. That's why the droplets and stuff could come out and people were passing along and didn't even realize it. That's where the biological part comes in at where the virus itself evolved over time with new variants affecting how easily it spread and how severe it was. It kept growing to be a beast just because most people wasn't either practicing safe distances, wearing their mask, or just trying to be in a better place, take better care of themselves normally than how they normally were living. Just because this was something new, we all didn't know how to control it. So with this, with people behaviors like mask wearing, social distancing, and vaccine acceptances that also shaped the pandemic, making it more of a beast than what it already was, as well as with the misinformation and vaccine hesitancy that made a huge impact on the public health responses. And with this happening, mutations led to variants such as Alpha, Delta, Omicron, affecting the transmissibility and severity of it. This talks about the social environment as well, with the healthcare access, public health response, as well as the misinformation and vaccine hesitancy. So a lot of people, either we know where COVID played a huge part and affected most areas was because of the healthcare access. Most people in low income and rural areas did not have the luxury to go to the doctor or possibly get seen, and most of them treated as if it was a common cold, which was the wrong thing to do because COVID was out and we knew it was very real, even though people didn't believe it to be very real. So the public health response to that was to have lockdowns, maintain social distance, and mask mandates. Of course, this may not work because misinformation was spreading and people were scared to get the vaccine just due to the fact that it was something that was being thrown together last minute. Some people were getting bad reactions out of it. Some people thought that the government was hacking it. So it was just a lot of things that made the situation a little bit worse than what it was just because of this. So with the trends and pattern as we see, when did COVID first appear? It appeared in 2019 in Wuhan, China. And from there, that's when we saw different waves of infection. Peaks happened during certain seasons, especially in the fall and winter, and hospitals even noticed different patterns where admissions would increase at the beginning of the week, possibly due to the weekend gatherings. Because at this time, people were still seeing each other. They took advantage of the fact that there were lower rates on the housing, apartments, traveling, airplanes. So people just thought this was a time to ball out instead of actually taking their health serious. So you see with the pandemic wave, we have our first wave in 2020, second wave in 2021, and third wave in 2022. This is where the different phases of COVID start to sneak in. And I attached a chart on the side where you can see the symptoms in deceased COVID patients, what they were experiencing, which was shortness of breath, fever, cough, sore throat, chest pain, and some who already had chronic illnesses that kind of played a part in making the disease affect them more strongly than others. So, and that was one of the main causes of deaths too, people who were already sick that may it was typically people who was diabetic or high blood pressure. So, conclusion, examining the COVID-19 pandemic through descriptive epidemiology help us understand key patterns, who was most affected, where the virus spread, and how different environments played a role in where cases surged. This insight is important for shaping public health strategies and designing targeted interventions for specific populations and regions. Thank you for listening.